All right, I have 12 p.m., so we are going to get started. Good afternoon, everyone. My name is May LaRue, and I am the Program Management Specialist on the Training and Education team here at the MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series. This is one component of our tobacco treatment and prevention education and training program, which is sponsored by and brought to you on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. This webinar will be recorded and posted to our website following the presentation. We are offering one continuing medical education credit and one CHES credit for this webinar, which will be sent to those who attend the entire session. In order to claim continuing medical education credit, you must have a profile in Cloud CME. If you already do, you will find your credits in your profile within a week of the event. If you do not have a profile in Cloud CME, you can find instructions on how to make one in the post-webinar email. For those that are collecting CHES credit, record of your attendance will be sent to NCHET on your behalf after the event. Only those who registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive credit. At the conclusion of today's presentation, an evaluation will appear on your screen as well as be sent to you via email. We encourage you to take the time to provide your feedback, as it is not only helpful to us in planning our webinar series, but to our presenters as well. Today's webinar is titled Brief Solution Focused Counseling, Applications for Tobacco Use Disorder Treatment, and is presented by Edward Perka of the MaineHealth Center for Tobacco Independence. Edward is a New York State credentialed alcoholism and substance use counselor with over 30 years of experience in the field of addictions. Edward has worked in a variety of settings, including inpatient treatment, intensive outpatient treatment, and long-term residential treatment. Prior to coming to the Center for Tobacco Independence, Edward worked for the Research Foundation for the State University of New York, where he managed a multifaceted project to design, develop, and deliver training and provide technical assistance regarding New York State tobacco policies, regulations, and clinical/program interventions in the treatment of tobacco dependence to New York State addiction service providers. Before we begin, all the phone lines have been automatically muted to help reduce background noise. We do, however, want you to participate in the session. Please type any questions you may have during the webinar into the Q&A box. For your convenience, a copy of this presentation will be sent out via email after the webinar. Throughout his presentation, Edward will be referencing a variety of handouts. These will be placed in the chat as they are mentioned, and you will have the opportunity to click to download them. They will also be included in the post-webinar email. And at this point, I would like to turn it over to Edward.
All right, thank you, May. And as I said, I am super excited to be here today to share this information with you. As May said, I am an addictions therapist, New York State credentialed alcoholism and substance abuse counselor. I'm also a tobacco treatment specialist, and I've been working in the tobacco field since about 2008. And I came to MaineHealth about 8 years ago, and I've been providing training and education about tobacco use and tobacco use disorder treatment ever since then. I am very pleased to be here with you today to talk about how we can improve the quality of people's lives by becoming tobacco free. It really is an honor and a privilege to be able to share this information with you. So while time doesn't permit us to introduce ourselves properly, I do invite you to use the chat feature to let the group know a little bit about you. There's quite a few people on today. Happy to see all of you. So if you want to share your first name, pronouns if you like, where you work, what your job role is, and just for fun, maybe something interesting about you. For example, I did introduce myself just now, but something interesting about me is that I've also been an acupuncture detoxification therapist. Also, as May mentioned, there are several handouts for today's webinar. If you can't access them for some reason, don't worry. We're going to attach all of them to the post-event email So you'll have them for future reference. So just a quick note, for simplicity's sake, we're going to be referring to the people we work with today as clients. So you may call them patients or participants or residents or members or something else, but please be assured when we say clients, we mean everybody. So I first want to tell you about the mission of the Maine CDC Tobacco Treatment Initiative. The MaineHealth Center for Tobacco Independence, or CTI as we call it, has served as the primary contractor of the Maine statewide tobacco treatment initiative since 2001. So we administer the Maine Quit Link, which is our state quit line, and we deliver provider education and training. Our training and education program is nationally accredited by the Council for Tobacco Treatment Training Programs and offers the training pathway for those pursuing tobacco treatment specialist certification. Maybe some of you are thinking about doing that. The Maine Quit Link offers free coaching provided by certified tobacco treatment specialists and also free nicotine replacement medications known as NRT for all Maine residents. Our training for healthcare professionals includes the essential skills training, the intensive skills training, the annual tobacco treatment and prevention conference, provider outreach, technical assistance, and a selection of specialty trainings like this one, webinars, online courses, and also sound bites. The sound bites are for those of you who like that podcast format. As we gather in this place, we want to acknowledge that we are occupying the traditional territory and ancestral lands of the Wabanaki people, who for thousands of years have called this place home. We acknowledge their continued connection to this land, give thanks for allowing us to do this good work on their homeland, and remember their ancestors who were here before us. Indeed, let us acknowledge all the indigenous people and their homelands in this nation west from here, of which we are all on and which we call home. And I also want to mention that references to tobacco in this presentation refer to commercial tobacco use and not to sacred and traditional tobacco use by American Indian communities. And quickly, let me share our disclosure statement. All planners, faculty, and others in control of the content of this educational activity have no relevant financial relationships with ineligible entities, that is, commercial organizations. So any questions and stuff that you have, please feel free to put them in the Q&A. May's going to be monitoring that. We can either answer them as we go, or hopefully you might have a little time at the end to answer them. But please feel free. I like to have interaction. I like to have questions. I like to have comments, especially when it's relevant to the work that you do. And maybe if you had some experience, you know, if we're talking about something and you have experience in that particular area, please feel free to share that. Would be great to hear that. Okay, I'd like to ask you this question. You can use that Q&A feature to respond to this. So if you could access handout number one, if you can, the confidence scale, or just take a look at it on the screen. On a scale of 0 to 10, with 0 being no confidence at all and 10 being as confident as you can possibly be, how confident are you right at this moment that you have the knowledge, skills, and abilities to use the techniques of solution-focused counseling to help clients become tobacco and nicotine free? So let me give you just a moment to respond to that, and maybe you could read off some of the numbers that you see coming in. I'll give you about 30 seconds on this one.
Yes, and we're getting a lot of answers, Edward. So I am seeing 2, a couple 5s, a 3, a 7, a couple 1s, a 10, more 7s, a
Super.
4.
All right. Now I have 2. Thank you, May. I have 2 follow-up questions for you to consider. Now, don't respond to these. Just think about them, okay, for a bit. Number 1, why did you choose the number that you did? And number 2, what would have to happen for that number to go up by 1? By the way, scaling questions are wonderful questions. I love them. It's part of one of my two favorite things that I use in my own work, that I have used in my own work with patients and clients. And that's how you process them, right? Why did you choose that number, and what would have to happen for that number to go up by 1? So keep that in mind. Keep your number in mind that you just gave me, because at the end of the presentation, I'm going to ask you the same question again. And it'll be interesting to see if the needle has moved at all. So here are the objectives for today. We're going to describe how people change. We're going to explain the basic tenets of solution-focused counseling, excuse me. We're going to contrast traditional counseling methods with solution-focused methods. We're going to identify and state some examples of solution-focused strategic questions, and then we're going to collaborate with the client to set goals using the SMART method. So let's discuss the process of change. So we're going to examine both the stages of change and the elements of change. Change is hard, as you know. I mean, really hard, right? The fact of the matter is that nobody ever taught us how to go about making significant changes in our lives. Nobody ever sat us down and said, look, these are the things that can help you make changes in your life, so write them down. No, we basically try to figure it out on our own, and that often doesn't turn out so well. What a lot of people don't understand is that change is a process, not an event. It takes time to make progress. It doesn't just happen in an instant. Unfortunately, we're all programmed for instant gratification, right? If it doesn't happen fast, we get frustrated, we give up. If we set goals that are unrealistic and unattainable, which happens a lot, right? We get frustrated as well. We start to believe we'll never be able to change. The second thing is that change usually occurs in stages or steps. So we know that most people who use tobacco want to change, and they think it's important that they stop, but there's a big difference between wanting to change and being ready to change. So if you ask someone if they think it's important to quit smoking, most will say yes. But if you ask them if they're ready to quit, that's a different story. So look at these quotations from participants on the Maine Quit link. They not only illustrate the fact that change is hard, but this particular change, overcoming an addiction, is one of the hardest changes to make ever, which is why people need help. That's the reason that counseling is such an important component of evidence-based tobacco treatment. Our job is to guide and support our client through the difficult change process. I like to think of counseling as any kind of interpersonal interaction we have with our clients. Now, some of you may be trained counselors, but some of you may not be. Your role might be different. If that's the case, don't get caught up by that word counseling. Anyone can be a counselor, right? You don't have to have intense specialized training or letters after your name. Simply stated, counseling is providing guidance in decision-making to help people reach their goals. It's about talking to people. And counseling doesn't have to be lengthy to be effective. A simple, brief conversation about tobacco is a form of counseling, an effective form of counseling. Which brings us to another point. Not only do people need to think that a change is important, they also need the confidence in themselves that they're capable of actually pulling it off. Sometimes we call this self-efficacy, sometimes we call it believing in ourselves, sometimes we call it intrinsic motivation, but whatever we call it, it comes from within a person. It's that internal voice that says, I can do this, I can be successful. So how does one increase their self-efficacy? How does one increase their internal motivation and confidence? How does one begin to believe in oneself? How does one move from importance to readiness to change? And part of the answer lies in our relationship with others. Just talking with people about our wants and needs and desires kindles our motivation to move towards those things. The more we articulate our thoughts and feelings to another person, the more likely it is that our confidence to effect change grows. The more we realize that it's not a matter of if we can change, but it's a matter of when it's going to happen, that makes the change almost inevitable. The affirmations we receive from others, for those of you that know motivational interviewing, and the knowledge and comfort and vigor we feel when others have confidence in us and encourage us, propels us towards readiness. That can happen in interpersonal interactions. So we can talk about all the barriers, right, and fears and pressures that we have to overcome. We can learn how to grow and change. We can look to the future. So many of you, I'm sure, are familiar with the Prochaska and DiClemente trans-theoretical model of change, or the stages of change. Prochaska and DiClemente developed this model from an examination of 18 psychological and behavioral theories about how change occurs. And for this reason, it's called a trans-theoretical model. So if you could access handout number 2, or the stages of change, the stages of change model shows that for most persons, a change occurs gradually, with the patient moving from being uninterested, unaware, or unwilling to make a change, which is pre-contemplation, to considering a change, which is contemplation, to deciding and preparing to make a change. Genuine, determined action is then taken, and over time, attempts to maintain that new behavior occur. So why is it important to know what stage of change someone is in? Because that determines your intervention. That determines what technique you're going to use and how you're going to interact with that client. Because we want to be client-centered, right? And do our best to meet the client's needs. Because we want to make the most of our time with the client. And because that eventually is going to lead to more successful outcomes. So how do you determine what stage of change a client is in? I used to just ask them, basically. I would run a psychoeducational group with the topic, the stages of change, and I would explain the stages just like we did, and then ask, what stage are you in? And you'd be amazed at how accurately people can assess themselves. This is a great group activity, by the way. I remember one guy telling me after a group that he was in pre-contemplation before the group, but now solidly in contemplation. And this is exactly the result that you hope for. The other way to assess the stage of change is to listen to what your clients are saying. You can evaluate a client's readiness by their statements. That's why it's important to be a good listener. One of my favorite sayings is, don't listen to respond, listen to understand. So we're going to do a tiny bit of practice. I'm not going to do this whole activity with you, but if you could access handout number 3, name that stage. I'm going to read a statement to you. And just for fun, let's see if you can determine what stage of change that person is. Remember, pre-contemplation, contemplation, preparation, action, maintenance. All right. Here's the first statement. I'll give you 10 seconds to respond to this, and we'll see what we get. All right. Here's the statement. I thought about cutting back on my smoking, but it just seems like too much effort. What stage of change do you think that person is in?
All right, Edward, we're getting a lot of answers. So I see some
Okay.
contemplations, mostly pre-contemplation though.
Okay.
And it looks like that's it, just pre-contemplation and contemplation.
Okay, here's the answer. That person is in the contemplation stage of change. And the way you know that is because they're thinking about it. Remember, pre-contemplation is before any thought. Pre means before, contemplation means thinking. Contemplation stage means they're thinking about it. And the key word in that statement, I thought about cutting back on my smoking, but it just seems like too much effort. So you know that person is thinking about it. Here's another one. Things are going pretty well. I'm starting to think of myself as a non-smoker. Things are going pretty well. I'm starting to think of myself as a non-smoker. This one might be a little bit more challenging for you.
Looks like most are saying maintenance, but we do have a few action in there as well.
Okay, so not so challenging. Yeah, this person is pretty much in maintenance. Action is just after that new behavior has started. It's a very vulnerable stage for people. But once you get used to it, and you feel more comfortable in your skin, then you're probably in that maintenance stage of change. So excellent. Here's one more, okay, really quickly. I really want to stop smoking, but I'm not sure how to go about it. I really want to stop smoking, but I'm not sure how to go about it.
We have quite a mix here, Edward. So
Okay.
I'm seeing pre-contemplation, contemplation,
Mm-hmm.
preparation. Some are saying action, but
Boy.
mostly
Okay.
preparation, contemplation, and pre-contemplation.
So we get a lot. Okay. Yeah. So just by that statement, I really want to stop smoking, but I'm not sure how to go about it. So the person hasn't stopped, right? But they're thinking about it. So it's not the action stage, right? It might be they might be in the contemplation stage and very close to preparation, very close to making that decision. But primarily this person is probably in the contemplation stage. This is a good example because contemplation can be a very long stage, right? You can be early in contemplation, you can be late in contemplation, closer to pre-contemplation on one side, closer to preparation on the other side. So, but it gives you a good idea of where that person is. And again, remember I mentioned that it's good to know where a person is in terms of their readiness to change, because that is going to determine your intervention. Excellent, good work. So let's take this a step further. We also want to talk about the elements of change. So just like importance and confidence, these elements need to be present if any meaningful change is going to take place. And these elements are called present discomfort, preferred alternative future, emotional security, internalized responsibility, and efficacy. And really quickly, present discomfort means that a person recognizes that something is amiss, right? There's a present discomfort. There's action that needs to be taken to address an issue. They're uncomfortable with their present circumstances in some way. It's basically an awareness that a change needs to be made in a particular area. For example, I really need to quit smoking. All right, that's a present discomfort. Preferred alternative future. All right, and this is where solution focused comes in. What does the client want their future to look like? We ask them to describe how they would like things to be in contrast to how they are in the present. You might hear somebody say, I really would like to be tobacco free. Emotional security. It's about feeling confident about navigating the world. All right, this involves feeling at ease, expressing your true self, being vulnerable, feeling that you don't need constant reassurance. Emotional security gives us the freedom to collaborate, to dream, to be creative, to share bold ideas, to feel compassion, and express ourselves freely with each other. If we have emotional security, we really feel like we can achieve our dreams. You might hear, for example, somebody say, I know that this is possible for me to achieve. Then there's internalized responsibility. Taking responsibility for your actions requires the realization that you play a part in every situation or experience and therefore have some degree of responsibility over the outcome or the consequences. You may have heard it referred to as accountability. So the statement, I can continue to smoke, or I can quit and be healthy, I know it's up to me, is a good example of this. And then finally, efficacy. So there's lots of ways to describe efficacy. I like this particular way, the power or capacity to produce a desired effect. And you might hear, I know I can do this, for example. So like the stages of change, these elements give us a roadmap of sorts when we're working with our clients. We ask questions that enable the client to determine where they are with respect to these areas and what needs to happen to achieve their goals. And remember, just like importance and confidence, if these elements are missing or they're tenuous, then the likelihood of meaningful change is also diminished. So you can use this almost like a checklist when you're talking with people. You know, what needs strengthening? All right, now let's delve into this idea of solution-focused counseling. So solution-focused counseling was developed by Steve DeShazer and Insoo Kim Berg and their colleagues beginning in the late 1970s in Milwaukee, Wisconsin. As the name suggests, it's a future-focused, goal-directed, and focuses on solutions rather than on the problems that the client is receiving services for. Other names for solution-focused counseling include solution-focused brief therapy, brief solution-oriented therapy, or simply solution-focused therapy. Now, in the most basic sense, solution-focused counseling, it's hopeful, it's friendly, elicits positive emotions, and this future-oriented technique for formulating and motivating and achieving and sustaining this desired behavioral change. Gives you a second. So solution-focused practitioners develop solutions by first generating a detailed description of how the client's life will be different when the problem is gone or their situation is improved to a degree satisfactory to them. So the counselor and the client, they kind of search through the client's life experience and their behavioral skills, excuse me, to discover the necessary resources that are needed to co-construct a practical and sustainable solution that the client can then implement. So typically, this process involves identifying and exploring previous exceptions. For example, times when the client has successfully coped with or addressed previous difficulties and challenges. So an inherently respectful and practical interview process, solution-focused counselors and their clients consistently collaborate in identifying goals reflective of the client's best hopes and developing satisfying solutions. So this has been used in a variety of ways. It's become one of the leading schools of brief interventions. It's become a major influence in business and social policy and education, criminal justice, child welfare, and also even with domestic violence offenders. So solution-focused counseling also is an evidence-based psychotherapy approach. There have been close to 150 randomized clinical control studies with different control populations in different clinical settings, multiple countries showing all positive benefit of the solution-focused approach. There's also been 8 meta-analysis on a range of outcome studies showing a positive effect for child, adolescent, adult populations, and for all kinds of presenting problems such as depression and stress and anxiety, behavioral problems, parenting, and psychosocial and interpersonal problems as well. Now, what's interesting is that solution-focused counseling is not often mentioned when we talk about evidence-based treatment for tobacco use disorder. Other therapies like motivational interviewing and cognitive behavioral therapy and pharmacological interventions have very strong bodies of evidence as to their effectiveness for tobacco treatment. Now, that being said, I think it's safe to say that the concept and techniques of solution-focused counseling are very compatible with MI and CBT and can be integrated very nicely into those methods. For example, both MI and solution-focused approaches mainly use questions, especially open-ended questions, to engage clients. Both methods encourage the client to find the solution within rather than have a solution imposed. And both methods have a strong belief in the dignity and worth of every person, and also that people have the strengths and the resources and the resiliencies to effect sustainable health change. So how is it different? So traditional counseling techniques tend to focus on exploring problematic feelings and thoughts and behaviors, and then providing interpretations, possibly confrontation, and education. In the traditional model, sometimes they call it the deficit model. The provider is the expert in diagnosing the problem and then applying a solution, often without the input of the client. In contrast, solution-focused counseling helps the client develop a desired vision of the future where the problem is solved. and then helps the client to marshal the strengths and the resources to make that vision a reality. Thus, the client finds their own way to a solution based on their own unique definition of goals and strategies and strengths and resources. For example, right, a solution-focused counselor might say to a client, I really don't need to know about your problems. In fact, you don't even have to tell me about them. What I'm really interested in is what you want different. What would your life be like if you didn't have this problem? This is one of my favorite methods of therapy with people, by the way. Let's explore some of the basic tenets of solution-focused counseling. As we go through these, think about how you might use these tenets with a client who is trying to stop tobacco use. So number one, it's based on solution building rather than on problem identification. So many traditional therapies spend a long time on developing a problem list. Then the counselor provides a plan to address the problems. Then the client is supposed to passively accept what the counselor is suggesting. That's not what happens in solution-focused counseling. The solution-focused counselor knows the client already has the solution to the problem within them, one that works for them and fits for them. The effort and energy of the solution-focused approach is directed at helping the client articulate the solutions, not articulate the problems. All right, number two, the focus is on the client's desired future rather than on past problems or current conflicts. All right, we're looking forward as opposed to backwards. What does the client want to be different, and how are they going to make that happen? All right, number three, right, clients are encouraged to increase the frequency of useful behaviors. All right, so once a preferred future is envisioned, the client is encouraged to think about how their current behaviors are either leading towards that vision or away from it. All right, sometimes we refer to this as developing discrepancy, right? Then they can discard the unhelpful behaviors and focus on the useful behaviors, right? And number four, there are exceptions to the problem, right? No problem happens all the time. A typical conversation might go like this. Tell me about those things. Tell me about those times that this problem is not occurring, right? What's the situation? What are you feeling? What are you thinking? What's different when the problem is not happening? And then number five, exceptions can be used to construct solutions. Ask questions like this. Why is the exception happening, right? Are you making it happen? What strengths are in play during an exception? Is there a reason for the exception? Do other people have anything to do with the exception, right? So you get the picture there. Finally, I would ask, what if the exception wasn't the exception, but the norm, and the problem was the exception? How would that be? All right, let me tell you a little story. For a long time, I've been in the business of helping people make difficult changes in their lives, right? But early on, I was pretty much of what I have described as a traditionalist, all right? I felt like I had all this knowledge and expertise that I could impart to my clients so they'd see the light, right, in the error of their ways, that listen to what I was saying. I wanted to convince them to change with my strong, direct, and logical reasoning. I was certain that I had the answers. I had the solutions. And if only they would do what I told them to do, everything would turn out fine. After all, I was the expert, right? If only they would listen. Except that didn't seem to work out very well. Long story short, things evolved. Now I know that my clients were not the ones who weren't listening, right? I was the one who wasn't listening. Or perhaps I should say, not listening to understand. Sure, I heard what they were saying, but all the while I was discounting their thoughts and feelings and thinking about what my plan for them was going to be. In effect, what they were saying didn't matter, right? I was making myself the expert of them. I thought I knew them better than they knew themselves. After all, I thought their best thinking got them to this point of despair and hopelessness and powerlessness in their lives. Wasn't it up to me to solve the problem for them and actually know. What I know now is that they didn't want my solution to the problem. They wanted me to understand them. They needed my empathy and compassion and validation. What I know now is that I can't solve other people's problems. I don't know what solutions are going to work best for them. I'm not the expert of them. They are the expert of them. And I've come to believe that people have innate resources, strengths, and resiliencies to find the solution that works best for them. So you can see the contrast here between traditional techniques and solution-focused techniques. Our role is not as the expert. What we can do is be a guide, a companion, a coach, a collaborator. We can be good listeners. We can listen to understand. Only in that way, I think, can we be of any help. So I sprinkled in a few quotations throughout the presentation that I think are relevant for our discussion today. This one is from Steve DeShazer, one of the founders of the solution-focused approach, and he said, "Problem talk creates problems. Solution talk creates solutions." So what makes a good counselor? Like motivational interviewing in CBT, solution-focused counseling is very client-centered. Client-centered care is a way of thinking and doing things that sees people using healthcare services as equal partners in planning and developing and monitoring their care to make sure that it meets their needs. This means putting people and their family at the center of decisions and seeing them as experts working alongside them to get the best outcome. Carl Rogers, who some of you might have heard of, 1902, 1987. He was an American psychologist and among the founders of the humanistic approach to psychology. So Rogers believed in embracing the absolute worth and value of every human being. Rogers referred to this embracing as unconditional positive regard, that is, respect for the client as having worth in his or her own right. And he believed that this condition had to be present and was necessary for any possible change to occur. The core conditions you see on the slide are central to a client-centered relationship. And the first is genuineness, being real, being yourself, matching your verbal and nonverbal behaviors, being spontaneous, being non-defensive. And then empathy, communicating understanding, connecting with feelings, recognizing nonverbal cues, discussing what's important to clients, showing a desire to understand their feelings. And then finally, respect, showing commitment, communication, and warmth, suspending critical judgment, which is a hard one, applauding a client's resiliency, and acknowledging that they're a partner in the therapeutic relationship. Clients engage most effectively with workers who use interpersonal skills to motivate and increase progress towards self-sufficiency. So these 6 interpersonal skills used effectively with the core conditions can enhance that therapeutic relationship and model for clients the life and communication skills that really facilitate finding positive solutions to life's problems. So the first is attending, right? You're conveying respect for and acceptance of and interest in the client through observing and listening, and through verbal and nonverbal responses, including eye contact, proximity, being encouraging, voice tone, inflection. Questioning. The counselor uses questions to encourage the client to share information, mostly open-ended questions, right, on the issues they want to work on, using those questions in a warm and caring and concerned way, utilizing different types of questions. We're going to talk about some solution-focused questions in a bit. Then reflecting, the counselor communicates an understanding of the client's feelings. That's the actual value of reflecting. Communicating that understanding of their feelings and their values and their beliefs by listening to the words and feelings in that message and then reflecting back through your own words and behaviors. And then concreteness. So clarifying vague communication, helping the client be specific about events, thoughts and feelings and behaviors and needs, and experiences in order to become more focused. And then listening, right? Give active attention to the words and the feelings and the nonverbal behaviors expressed by the client. And you're able to assess the amount of congruence present among those words. And then summarization, the last thing. So the counselor shares the key or salient points shared by the client in the interview. So this skill enables the worker to check out whether the worker has heard the client accurately and engages the client in setting mutually agreed upon goals for the next session. So I'm sure, right, that you've noticed that the core conditions and interpersonal skills aren't unique to solution-focused counseling, but are universal in establishing a trusting and therapeutic relationship. So remember, I mentioned the deficit model of therapy, and this means that the counselor thinks that something is missing in the client, and the counselor's job is to discover what's lacking and then apply a fix to that by inserting or applying something into the client, whether it be some kind of knowledge or information or coping skills or a specific treatment for a medical condition. Hence, right, deficit model, I have what you need, I'm going to give it to you. Now, this approach might be useful in certain situations, but it doesn't work very well when you're dealing with behavior change. Remember that the client already has the solution within him or her. So the counselor's task is to draw out or evoke those arguments for the client to examine and process. Hence, you have what you need, and together we'll find it. So clearly, this is the opposite of the deficit model. You're working with the skills and resiliencies and the strengths and the perspectives and the wisdom that the client already has. You're guiding them in finding the solution that works for them. You're helping them to determine what path they want to take. And this defines the nature of the relationship: collaborative, non-confrontational, curious, forward-focused. Okay, and go with me on this one, all right? Relax a little bit, make yourself comfortable, close your eyes, right? Focus on your breathing for a couple of seconds. I'm gonna ask you to visualize something in your mind. So just everybody calm right down. Think about the person in your life that you trust or trusted the most, the person that was always there for you, who never hurt or betrayed you. Think about some of the qualities of that person. What are they? What made that person so special in your life? What made you so special in their life? How do you feel when you think about that person? And how much are you like that person? So reflect just a moment on how your clients may see you, right? How do you think you come across? For example, what is your level of concern for your clients? How much do they trust you? What's your level of optimism for your clients? How effective are you with your clients? So I think we can all agree that the core conditions and the interpersonal skills are crucial to establishing a therapeutic relationship, building trust, and helping people solve their problems. So as you consider all these things, ponder this question: what is one thing that I can do to make me a better counselor? So obviously, some of us will have to do more than others, and others may be very close to being the best they can be already. That being said, there's always more to learn, and there's always room to grow. Okay, so our next step is to learn all about solution-focused language and questions and how these tools can help us in being more effective with our clients. A little more food for thought. I like this one from Insoo Kim Berg. There's a way to see it, and there's also another way to see it. I think that's very cool. How many counseling languages do you speak? Right? What I found in my years as a therapist is that there's common threads in all types of therapies and theories. In fact, many of the things I've already said about the solution-focused approach may apply to motivational interviewing or cognitive behavioral therapy or numerous other approaches. In fact, they often borrow from one another and build off one another. So you may find, as we talk about solution-focused language, that these connections, these understandings, and these universal elements that all serve the same purpose, right? They help our clients heal and grow and thrive and improve the quality of their lives. I like Goethe, all right? Goethe was a German writer and a statesman, and he said, the way you see people is the way you treat them, and the way you treat them is what they've become. So that's pretty insightful from Goethe. If you're a deficit counselor, you see people who need to be directed. You see people who need your expertise and problem-solving skills because they lack them. If you see them that way, you're going to treat them that way, and they will become that way. On the other hand, if you see people that have the capacity to change, if you see people who have strengths and resiliencies, if you see people who can solve problems and make decisions for themselves, you will treat them that way, and they will become that way. That's why language is important. So we're going to look at the language of solution-focused counseling. Some conversations enhance the possibility of change. Others make change less likely. When possibility is enhanced, hope is present. We have a sense that we can take the necessary actions to address what concerns or troubles us, to accomplish our goals, our ambitions, our dreams. So our language needs to be inclusive, right? Meaning the client is an equal partner in this effort and actually is the main player, so to speak. So they're the ones who are going to find the solution to their problem. We're simply the guides, and everything we say should reinforce this. So note the subtle difference in the two statements on the slide. One of the most dismissive words you can use is but. The word but dismisses the effort the client is making. It suggests they might not ever be able to find the solution. On the other hand, the word and is inclusive language. It suggests that it's only a matter of time before the solution is found. It affirms for the client your belief and confidence in them. Watch where you put your but. Another inclusive phrase I like is so far. And so far, you haven't come up with a solution. Again, implying it's only a matter of time. Much like inclusive language, language that presupposes change signals our belief that the client has the resources and the strengths and the resiliencies to ultimately reach success. This example simply changes one word, if, right, becomes when. So it's not a matter of if you can do it, it's when it's going to happen. Remember Goethe, right? The way you treat people is the way they will become. Validating what clients are already doing well and acknowledging how difficult their problems are encourages the client to change while giving the message that the counselor has been listening and understands and cares. Indirect language serves to identify and validate what the client is already doing that's working. In solution-focused counseling, indirect language often takes the form of appreciatively phased questions like, how did you do that? That invite the client to self-compliment by virtue of answering the question. This slide gives you a few more examples of indirect language. What helped you to become so smart? You know, how did you become so confident? So what does your many years of experience tell you about how to be successful? Now we get to the fun part. What are the different types of solution-focused questions? A question can simultaneously ask for information, identify strengths, point to change, and serve as an intervention. In solution-focused counseling, the questions become the main tool for assisting the client in identifying potential solutions to their problems. These questions tend to be open questions or open-ended questions. And an open question is like an open door, right? As you know, encourages a full and meaningful answer based upon the client's own experience and knowledge and feelings. It invites clients to tell their story in their own words without leading them in any kind of specific direction. They're the opposite of closed questions. Closed questions can typically be answered yes or no. So think of open questions as conversation starters.
Hey, Edward,
Yes,
just letting you know you have about 10 minutes left.
thank you so much. Let's take a brief look at each of these questions. So access handout number 5, if you can. And that is on solution-focused questions. So I'm going to read the list. All right. And they're kind of described in handout number 5, and we've got some examples there. So we have present and future focused questions, and I'll just give you a quick example of that. What will you be doing next week that would indicate to you that you're continuing to make progress? Right? Presupposition questions. What will you be doing differently when you find the solution to this problem? Previous solution questions. How have you dealt with this problem in the past? Exception questions. What's it like when you don't have this problem? Unique account, right? Where did your confidence come from? Perception questions. How do you feel about the current situation? Relationship questions. Who is important in your life, but is not here right now? And then I'm going to get to the next two, my two favorite solution-focused questions, the scaling question and the miracle question. So the questions asked by solution-focused counselors are usually about the present or the future. And this reflects the basic belief that problems are best solved by focusing on what is already working and how a client would like their life to be rather than focusing on the past. So I am going to, as I just read a couple of examples of those questions, I just want to get to this. Now, look at this. The idea of focusing on the future has been around for quite some time, given that Socrates died somewhere around 399 BC, right? Just saying. So Socrates said, the secret of change is to focus all of your energy not on fighting the old, but on building the new. Go Socrates. All right, and I'm gonna go through these because I just gave you some examples of these questions. And again, on your handout, there's a couple more examples of these kinds of questions. I want to get to this one. I like this decisional balance exercise. You can actually look at handout number 4. If you pull out handout number 4, I had it kind of in a reverse order there, but it gives you a kind of grid. And there are 4 areas of questioning in this grid: the good things about smoking, the good things about quitting, the not so good things about smoking, and the not so good things about quitting. And I like to use non-clinical language when I do this. Helps to put clients at ease. For example, we use good things instead of benefits or pros. So I particularly love this as a group activity due to the richness and variety of the responses. And you actually have a template if you want to use this activity in handout number 4. And this is a typical response to a decisional balance exercise, as you can see. I like this one. My first thought was, you are so right. Sam Owen is an author and a relationship coach, and she's a proponent of the solution-focused approach. So always think in terms of solutions. Focusing on the problems usually gives us more of them. And then the couple more perception questions that we already talked about and relationship questions. Okay, I've saved 2 of my favorite kinds of questions for last. I love the scaling question for a bunch of reasons. They're curiosity questions, right? They really help you and the client to gain a better understanding of the starting point, right? So remember I asked you that question on a scale of 0 to 10 and the 2 follow-up questions. Scaling questions can stimulate problem solving and solution-focused thinking. And now my number 1 favorite solution-focused question of all time is the miracle question. And here's a version, right? If a miracle happened while you were sleeping and your problem, let's say the problem is smoking, is now solved, but you were unaware of this change because you were asleep, how would you come to know this miracle had happened? I have a very short video I want to show you, which I really like about the miracle question.
Suppose tonight, while you're asleep, a miracle occurs, and this miracle solves all of your problems. Of course, when you wake up, you don't know that the miracle happened because you were asleep. So what would be the first thing that you would notice that would tell you that something miraculous occurred? What would you be thinking differently? What would you be doing differently, believing differently? What would your spouse or children be doing differently? So this is called the miracle question. The miracle question is one of the main questions of solution-focused therapy. And I've written before about solution-focused questions and how our questions can really define our reality. They can shift the way we think about things. And a great way to really think about this is to imagine a courtroom. You've got two attorneys on either side, and you have one witness. And each attorney is asking the witness very, very different kinds of questions. Because each attorney is trying to create a reality. They're trying to maybe shift the attention off of something or shift the attention toward something. And so the questions they ask do this. And so we do the same exact thing. The questions that we ask ourselves define our reality. So we need to start asking better questions. And so the miracle question is one of the greatest questions, one of my favorite questions, because it really focuses in on what you want different, what you want differently out of life and in the future. Solution-focused therapy is different than many of the other kinds of therapies out there, and probably many of the ones that you're familiar with. So most therapies, you go in, you sit down, and the therapist starts asking you about all of your problems. Why did you come in today? What's the problem? What's bothering you? What's wrong? And then they start talking about the past. What did your mother do to you? What happened when you were 9 years old? And let's focus on the past and all your problems. So solution-focused therapy, they don't really care about the past, and they really don't care about your problems. They're much, much more interested in what you want differently. So instead of what you're trying to run away from, it's what are you trying to run toward? And so that's the genius behind solution-focused therapy, and also the genius behind solution-focused questions.
Love that video. All right, and it's really good to have a vision of the future, right? But how are you gonna get there? It's gonna take some planning. So handout number 6 shows you SMART goals. And the SMART goal, just an example, specific, measurable, attainable, realistic, time-bound, is a very good way to set goals with people because it gives clear and actionable steps for them, and also has a predetermined endpoint where you can actually take that goal and then reassess it. So SMART goals, very, very good tool. I recommend that you use that with your clients and your patients. And so we're going to wrap this up with another thought. Lila Gifty Akita is also an author and an inspirational writer, and she wrote, "There's always a solution to any challenging situation." Last but not least, you don't need to weigh in on this because we are almost at the end. Recall the confidence scale at the beginning of the training. Do you remember where you put yourself on that ruler? I just wanted to check in again with you. I just want you to think about this. Did we help move the needle? So I certainly hope this has been helpful to you and useful to you. And best of luck to you in your future work, helping people to become tobacco-free. That brings us to the end of the presentation. As always, we welcome your questions and your comments and your observations. You can reach us at the email shown on the slide. And my closing thought for you is this: we're all individuals, we're all unique, we're all different in our attitudes, values, and beliefs. But there's one way we're all alike: the desire to help others find their own path to health, vitality, serenity, and recovery. So thank you for being here today, and thank you for all the good work that you do. You make a difference. Thank you.
Thank you so much, Edward, for such a wonderful and informative webinar. I am not seeing any questions right now, and we only have 1 minute left. So if anybody does have questions or comments, we encourage you again to email us at the email that you see on the screen. And I'm just going to read a few reminders, and then we will be all done. So once again, this webinar was recorded and will be posted to our website. In order to claim continuing medical education credits, you must have a profile in Cloud CME, and instructions can be found in the post-webinar email that will be sent out in the coming days. For those that are collecting CHES credit, record of your attendance will be sent to NCheck on your behalf after the event. Only those who registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive credit. You will receive all of this information again and a copy of Edward's slide deck and the handouts in the post-webinar email. As a reminder, an evaluation will appear on your screen once the webinar is closed. Please take the time to provide your feedback. And if you have any questions, again, our email is right there on the screen, and we thank you so much for your participation today. Take care, everyone.